ASMR with Bean Marie. Hi there. I'm Dr. Bean. Nice to meet you. What a beautiful name. I understand that you've been having some eye pain lately. Okay. Let me just take down a few notes. Okay. Regarding the eye pain, tell me what you're experiencing. Bit of dryness. Okay. More so when you're blinking. Okay. Really? Okay. When your eyes are closed. Yeah, dry eye can certainly happen at times, yeah, but this sounds maybe a bit more chronic. Pain when touching around the eye. Okay, do you use eye drops? No, okay, we're gonna get you doing that, okay. But let's just analyze a little bit closer to make sure there's not anything going on more severe than just dry eye, okay? Yeah, we'll just check to make sure everything looks good in the back, your retina, your cornea, all of that, okay? Just gonna conduct a few tests, okay? Okay, bear with me one moment. Just gonna cleanse my hands really quickly. Okay. How are you enjoying it here? You've never been to the East Coast. So you're just visiting? Oh, for the full summer. You have work here? That's nice, yeah. I'm glad you chose to come into our office today. We're always happy to take new customers and new patients. Yes. We do get very good reviews typically. Just gonna put some gloves on so that it's nice and hygienic, okay? Just gonna start off by looking at your eyes, okay? Can you just keep your eyes as wide as you can for a second? I'm gonna grab your eyelid right by your lashes and just pull up very gently. I promise it won't hurt. It might tickle a little bit. Just gonna. Let me just see. Okay. Just making sure. Okay, very interesting. A little bit of redness, which makes me think the dry eye has probably been really taking a toll on you. Mixed with allergies, potentially. I can only imagine how annoying that is. Okay. I'm just gonna grab one of my lights here. This will help me to test your pupil dilation as well, okay? And then just taking a closer look. So maybe having you look up and down, side to side, okay? Let's just start checking your pupils, okay? Just look straight at my nose. Okay. Straight at my nose. Good. Keep looking at my nose. Don't follow the light. closer look here. Everything looks good with your pupils, so no need to worry about that. And I am seeing that redness again, which I would imagine is from the dry eye. Okay. But you do have allergies as well. Yeah, and it's literally spring right now, so that makes sense. I'm going to apply these eye drops into your eyes, okay? They're just gonna help me to see how you react to the eye drops. If your eyes take very well to them, then that's a good sign. If you have a reaction, not likely, but if you do, or it doesn't help at all, then we're gonna have to keep looking further into it. Could be the issue, okay? So I'm just gonna stand up and get close to you here, okay? Just gonna use this tissue to block. And just keep your eyes open, and I'm just gonna pull on your lid slightly. Putting it in the corner of your eye. Shouldn't be too shocking. Just plotting that for you. Make you cry before you go to work. Okay. These drops are highly hydrating. If it works, then we should see some great results, okay? Now, these are not meant to be used daily. I do have drops for that, but these are more maybe a couple times a week. They're very heavy, moisturizing. If you use them too often, you do run the risk of getting styes. So we just want to make sure that you're only using it maybe twice a week, okay? And then I'll provide you the other eye drops for daily. Okay, let's take another look. Do you want the tissue? Yeah. It might make your nose a little runny as well. It's okay. There you go. Let me grab my light 1 second, okay? Here, I'm just using a special scope as well to help me to see a little more magnified into your eye. Okay. I know it's a little silly looking. Okay, ready? Keep your eyes open. I know it's bright. But we need to see everything going on in there. Just keep your eyes nice and wide. Very good. Okay, very good. Let's see. Okay, yeah, definitely. It looks like your eyes. Let me just get a little closer. Your eye has made great progress with this drop. It does take a little while to activate, but I'm already seeing a result, so that's great. Yeah, so I mean, it's not typical for someone your age to be getting such dry eyes. I'm just curious, have you changed up your medication at all? Oh, okay. Certain anti-anxiety meds do have side effects. Yes. Though I've never heard of dry eye as one, but I mean, certainly could be possible. I'll have to look at the full list. It's just something you might want to talk to your primary doctor about, okay? Yeah, let me just see one moment here. I just want to make sure that there's no damage to your eye as well. You do wear contacts, so if there's any scratches or debris or anything up in your eye, yeah, that could also be affecting some of that dry feeling, that scratchy feeling, okay? I'm actually going to use these tweezers to help lift up your eyelid and kind of fold it. I know that sounds scary, but it won't hurt, I promise, okay? Okay, so just stay still. Just take a deep breath. Relax. I'm just going to be lifting up your top eyelid here. And just looking again. Okay. Very good. Okay, not bad at all. I know it's bright. Sorry about that. Okay, luckily nothing going on in there. This could be a simple case of dry eye, possibly medication reaction. Yeah. Have you had any other new side effects you noticed? Really? Well, I could imagine a lowered, slowed heart rate could be from the anxiety medication, just helping you to have more of a normal heart rate. Less of that anxiety that can raise your heart rate. Exactly. Well, I'll just take a listen real quick, okay? Yes. Okay. Just take a few deep breaths for me. And when you let out this last breath, just hold your breath for a second, okay? Okay, now breathe regularly. I don't know, your heart definitely sounds normal to me. Nothing out of the ordinary. Let me just take these off. I'm just gonna write down some notes. I do like to provide a very thorough analysis for my patients, so we will leave no stone unturned. But it sounds like at this point, it's a simple medication side effect issue, combined with some maybe genetic dry eye kind of thing. Okay, so that's... No, I know they're never too lengthy. That's the nice thing. Well, if your doctor's appointment is short, that means it was a quick fix. It's always a good thing. Especially the eye doctor, yeah. Tends to be like in and out. We don't get too busy here. There's not really a lot of optical crises. Luckily. Yeah. Have you thought about getting LASIK? Yes. Well, if you're interested, you can consult Sherry at the front desk. Okay, she does all the coordinating for those appointments. You would need a separate consultation appointment. It might be included with your insurance, that one. Possibly not though, but you can check in with her. She has all that information. Okay. So what was your birth date again? Just want to make sure everything's correct on here. Okay. Now I'm gonna write you a prescription for these fancier eye drops that you're gonna use twice a week. Okay. And then the other ones, let's see, where are they? These ones, yes. These are over the counter. It's just Sustain Ultra. This is our recommended brand, okay? And you can use these as much as you want. They do get expensive, I know. Okay, so let's get you 2 times. Beep. Until the bottle's gone, yeah. It's not something you'll use forever. Well, it shouldn't be, so hopefully this combined with your medication evaluation with your primary doctor will resolve the issue, okay? Okay. I'm gonna have you take that up to the front with you, okay? Yeah, just so they have it on file. I'm also gonna call in the prescription with your pharmacy as well. Yes. It should be ready today, but the pharmacy will let you know. Okay. It's been really nice having you in our office today. I do hope that you'll continue to enjoy the East Coast. Do you have any questions for me today? Any concerns? Yeah, any insurance questions would be best discussed with the front. They can direct you better. I'm more of the science kind of girl. Yeah, I don't know as much about that aspect, but yes, perfectly safe. Yes, it's just that we don't want you using those drops for too long because your eyes can get kind of used to it. This is a fixable problem, then we just want to heal the eyes and then figure out how to get rid of the problem so you don't need to use them. They also can be pricey if insurance doesn't fully cover, so yeah, I do know about that. Yes. Okay. Yeah, well, I do hope your eyes start to feel a lot better, okay? Keep using the Sustain Ultra drops. Here, I'll actually give you the rest of this because we opened this bottle for you today. Little perk of coming in here. And you can pick these up at the drugstore. Okay. No other questions? Okay, great. Well, again, it's been so nice to meet you. Do call if anything gets worse or isn't getting any better, and we'll schedule you to come back in. Do call if anything seems to be getting worse, so we can schedule you for another appointment if needed. But otherwise, you should be all set to go. Okay, love.